This presentation covers the benefits of exercise in pulmonary rehab. For people with chronic lung disease, exercise is one of the most effective treatments available. It doesn't cure lung disease, but it does help the body use oxygen more efficiently and improve daily function. Exercise won't change your lungs, but it can change what your body can do with the lungs that you have. The philosophy of our program is that exercise is medicine. If exercise could be put into a pill, it would be the single most prescribed medication in the world. But unlike most medications that just target one specific area, exercise has a positive impact on your entire body. Our bodies were engineered for movement, and establishing a consistent exercise program is one of the most important keys to managing pulmonary disease. This diagram depicts what we call the vicious cycle of inactivity. When you become short of breath, it's natural to become fearful of the activity that makes you breathless. So you start to avoid those activities, meaning that you do less and your body is moving less. As a result, your muscles become weaker. Weak muscle needs more oxygen. They're less efficient at using oxygen compared to a strong muscle. Because of this, you feel increasingly more short of breath doing the same everyday task, grocery shopping, walking up the stairs, or even gardening. As this cycle continues, everyday tasks, activities of daily living become more difficult. Endurance declines, daytime fatigue increases, confidence decreases, and the anxiety around breathlessness increases. It can all result in a loss of independence. Pulmonary rehab helps to break this cycle by strengthening the muscles, and as you become more aerobically fit, you can perform activities at a lower percentage of your max effort again. These are some of the more significant benefits of exercise that we'll talk more about. Improvements in strength and endurance, improved balance, which decreases the risk of falls, a reduction in symptoms, improvements in breathlessness, increased energy levels, decreased exacerbations and fewer hospital visits with shorter stays, an increase in the ease of activities of daily living, and improved sleep. Activities of daily living can take up a lot of effort and energy, which is why we have an entire talk on managing them. As you become stronger, getting through the day becomes easier, and while that is nice and desirable, the real benefit is that it allows you to have the energy you need to do the things you want to do, the things that bring joy into your life. When it comes to exercise, sleep plays an important role in muscle recovery. How does exercise help that? It makes it easier to fall asleep and has been shown to help us spend more time in the deep, restorative sleep that's important for recovery, repair, and even immune function. If you exercise outdoors during the day, it can help reinforce your circadian rhythms, making it easier to fall asleep at the appropriate time of day. Exercise can also reduce the symptoms of conditions that interfere with sleep, things like chronic pain, depression, insomnia, and obesity. How will exercise impact the lungs? Overall, health is improved. Your immune system is stronger. It reduces the chances that you're going to get sick, and if you're not getting sick, you don't need to recover from a respiratory infection. Exercise creates a deeper, more efficient breathing pattern, meaning that it can cause less air trapping and overall improve lung function. It also functions to build strength in respiratory muscles, like the intercostal muscles that are in between your ribs, or even your diaphragm, for example. Learning to coordinate breathing with exercise, whether you're strength training or doing aerobic type training, learning to coordinate movement and breathing leads to a greater sense of control, which helps decrease the anxiety and the fear associated with the shortness of breath. Not all shortness of breath means that you need to stop. Sometimes it means that you need to slow down, regain a calmer breathing pattern, and then continue. Exercise can help decrease dynamic hyperinflation, which is when the lungs don't fully exhale before the next inhalation. This can lead to air trapping. As you become more fit, you can breathe more slowly while exercising at the same levels. A slower breathing rate gives the lungs more time to fully empty, which reduces air trapping and makes breathing feel easier because your next breath in can be a full breath. Exercise positively affects the cardiovascular system in multiple ways. First, it strengthens cardiac muscle or makes your heart stronger. This improves its ability to pump blood efficiently throughout the body. It also helps to improve blood vessel function, which promotes the delivery of oxygen to exercising tissue. Exercise also helps to manage major cardiovascular risk factors, things like hypertension, diabetes, and cholesterol. When it comes to hypertension or blood pressure, after exercise, there's a drop in blood pressure that can persist for up to 24 hours. This is notable because even though it's a small drop, chronically over time it can start to have a lasting impact on blood pressure and the management of hypertension. Insulin is a hormone. It's the key that brings glucose from the bloodstream into the muscle cell to be used as energy. The strong muscle contractions of exercise causes muscle cells to be more responsive to insulin, which helps in the management of blood sugar levels, and this too can last for up to 24 hours after a bout of exercise. Lastly, exercise plays a role in helping to maintain healthy cholesterol levels. Most significantly, it can increase our HDL or our good cholesterol while also helping to lower LDL cholesterol. It is worth mentioning that endurance exercise or aerobic exercise like walking, biking, swimming, that type of exercise is the exercise most significantly associated with an increase in HDL cholesterol. What exactly causes a muscle to become stronger and endurance to improve? If you think of your muscles as a team, when you exercise, you're giving that team a challenge and they respond by adapting to better meet it. Adaptations occur in the muscle cells themselves with an increase in the number and size of mitochondria. You've probably heard of mitochondria as it's often described as the powerhouse of the cell. It's where energy is produced. Mitochondria helps your muscles use oxygen better so they don't get tired as quickly. The more you have, the better, and with exercise, they increase in both size and number. The good news is these changes start to occur in as little as 1 to 2 weeks. Within 6 to 12 weeks, there's a substantial improvement in the number and size of mitochondria in your muscles and how easy it starts to feel, or how much easier it starts to feel when you're exercising. Circulation also improves with exercise. Your body adapts by creating more capillaries, or the tiny vessels that help deliver oxygen to exercising muscle. Again, the more the better. It just makes exercising and the work you're doing feel a little bit easier. Your brain and nerves also start to coordinate as your body becomes trained. They learn to activate your muscles more effectively by recruiting both more muscle fibers and also recruiting them quickly, faster, to meet the task at hand or the exercise that you're doing. Another way you see an improvement in strength is the reversal or slowing of normal age-related changes. With age and inactivity, there is a progressive loss of muscle mass, and challenging your muscles helps to slow and in some cases even reverse the loss. Exercise is about as close as we can get to the fountain of youth. As strength increases, most people report a decrease in fatigue as everyday activities can be done with less effort, things like carrying groceries, walking up the stairs, and even showering. Your lungs may have a limit that's difficult to control, but what you can control is your muscle strength and the positive impact that strong skeletal and cardiac muscle have on the way you feel. With age comes a decrease in bone mineral density, but significant loss is not inevitable. Most people can slow, stop, or even improve bone mineral loss before it becomes severe. Osteoporosis is a condition in which bone loss outpaces bone formation. Because bone is a living dynamic tissue that undergoes a continuous process of remodeling, lifestyle changes like a well-designed exercise program can improve bone health significantly. While everyone can benefit from strength training, if you have been told you have osteoporosis, it's wise to consult a healthcare provider before starting a program to ensure that strength movements, like certain degrees of bending, are safe for you. Exercises need to be challenging enough to stimulate the skeleton, and it takes either weight-bearing exercise or resistance training to do so. The force placed on the skeletal system during weight-bearing exercises sends a signal to the brain to stimulate the changes that encourage quality bone formation. This is your body's way of becoming more efficient. It adapts to the work you're asking it to do. Proper nutrition also plays a critical role in the formation of bone and will be discussed in greater detail during our nutrition talk. Walking and strength training don't just strengthen muscles, they protect bone by reducing the risk of fracture as a person ages and stimulating the formation of quality bone tissue. Balance exercises improve coordination and reaction time and help to greatly reduce the risk of falling. They should be a part of your program 2 to 3 days a week. Exercise is one of the most effective non-medication ways to improve mental health. The effects are both immediate after a single session and long-term as a result of regular exercise. The mind and body work hand in hand. When one feels better, so will the other. Movement is a healthy outlet for the release of physical and emotional tension. It's like medicine for your mind. During exercise, the body releases endorphins. These are the feel-good hormones that help to regulate mood and motivation. Research has shown that symptoms of mild to moderate depression and anxiety are lessened when cortisol levels fall after an exercise session. Research has also shown us that sedentary individuals are up to 50% more likely to experience symptoms of depression. Better sleep can help with emotional resilience, and confidence gets a boost when you start to move your body regularly. You realize what you can still do, and it gives you some control over your condition. Lastly, in a program like Pulmonary Rehab, it helps to create social connections and builds a sense of community. You aren't alone, and even on days when you don't feel like exercising, a few minutes of movement can make a real difference. Now that we've talked about benefits of exercise and how it impacts all different areas of the body, let's talk about prescription, when to do it, how to do it, and how to keep it safe. Before we get into the details of prescription, let's clarify the differences between physical activity and exercise. Physical activity is highly encouraged and of great value, but it is different than structured exercise. Physical activity is any movement your body does that uses energy. It's unstructured, spontaneous, and includes things like cleaning, casual walks, caring for children, shopping, gardening, or yard work, that sort of thing. There's no clear fitness objective associated with physical activity, but again, to be clear, it's still an important part of a healthy lifestyle that we encourage. Exercise, on the other hand, is activity that is structured with specific exercise goals in mind. It includes aerobic or endurance training, resistance training, along with balance and flexibility. A true bout of exercise keeps your heart rate consistently elevated for at least 15, maybe 10 minutes if you're just starting out. If you want to start to see the benefits of exercise, you need to get your heart rate elevated for a period of time. We accomplish this in pulmonary rehab in a safe way by using an exercise prescription that's based off of your 6-minute walk test. It gives us a target heart rate range that we reference for exercise, and it's individualized for each person. So, kind of in closing here, as we like to say, all exercise is physical activity, but not all physical activity is exercise. Our exercise guidelines come from the American College of Sports Medicine. The ACSM gives official guidelines for intensity and frequency of different types of exercise needed to see improvements in fitness. Moderate on our RPE scale is a rating of 3 to 4. This equates to about 30 minutes of exercise 5 days a week, and exercise can be accumulated throughout the day in shorter 10 to 15-minute sessions. High intensity on our RPE scale is a rating between 3 and 5. If you're into efficiency, you can get away with less time here. Don't let the phrase high intensity intimidate you. Research has shown that especially in a pulmonary population, higher intensity intervals are often better tolerated than continuous hard exercise. Interval training at higher intensities lets you exercise at the higher workloads associated with greater gains in fitness while keeping symptoms manageable. Simply put, you can work hard for a few minutes and then recover and regulate your breathing. Strength training is encouraged 2 to 3 days a week. With strength training, you should take a day off in between sessions and choose either a heavier weight that allows you to do 6 to 8 repetitions at a time, or a lower weight that allows you to do no more than 10 to 12 repetitions at a time. Flexibility is encouraged most days of the week, and if possible, a stretch can be held for between 30 seconds and 1 minute. In pulmonary rehab, we use 2 different scales to rate perceived exertion. Our goal isn't to push you to your limit, it's to challenge you in a way that's safe, that allows for adaptation to exercise. You should feel like you're working hard, you're breathing harder, but that you're still able to recover and come back for your next session. The Borg scale is specific to breathing. Most exercise is prescribed at a level of 4 or below. And then on our RPE scale, which goes between a 0 and a 10, exercise is typically prescribed between a 3 and a 5 with an upper limit of 6 during pulmonary rehab. With age and inactivity, there is a loss of muscle, but like bone, this is something that you have control over. Strength training addresses muscle loss by targeting specific muscle fibers. Strength or resistance training works because of a concept called progressive overload. It means in order to get stronger, the resistance must be greater than what your body typically encounters in day-to-day life. Carrying around a heavy bag and then weight training with a lighter weight won't make you stronger. Soreness after a workout is expected, but you should feel better within a few days. Taking a day off in between strength workouts is recommended. How do you know if you're lifting heavy enough or when it's time to increase your weight? When you finish a set, you should feel like you can only lift that weight 2 to 3 more times before you need a break. Breathlessness isn't the goal of strength training, but muscle fatigue is, and you should feel like you need a short break to recover after a set. As you progress through pulmonary rehab, we help to make sure that you're lifting a progressively heavier weight to maximize benefit. With aerobic training taking up the most time in an exercise program, it's important for you to choose something that you enjoy. Know yourself and what motivates you. Are you someone who needs a group for the social aspect or accountability, or do you prefer exercising on your own while listening to music? Time of day can also make a big difference. Choose whatever it takes to keep your body moving and your heart rate elevated. If you only have a short amount of time and aren't sure what to do, you can always do a few rounds of the pulmonary rehab warm-up exercises set to music that you enjoy. These are familiar, it'll elevate your heart rate, and they're also great for mobility. One of the goals in pulmonary rehab is to help you leave with an established home exercise program, so let's consider early on what that will look like for you beyond these 8 weeks. 30 minutes most days of the week is the recommended amount of exercise for a moderate intensity, a little bit less for high intensity. 30 minutes can seem daunting, especially on days that you don't feel well, but don't get discouraged. Some movement is always better than nothing, and consistency is more important than any amount of time. High-intensity interval training, or HIIT interval training, allows you to build aerobic fitness faster and also become more comfortable with exercise at higher intensities. In your binder, you'll find some examples of specific interval workouts. HIIT is time efficient and results in health benefits at a faster pace than just moderate intensity exercise alone. One of the keys to successful interval training is to not overdo it on the recovery interval. Use that time to fully recover so you can exercise at that higher intensity during the hard interval. It's also recommended that you use a form of exercise that you're already comfortable with. HIIT is best suited for people with stable lung and cardiac conditions, and it's recommended that you start with continuous moderate exercise, get yourself comfortable with the machines, and once symptoms are managed and you're comfortable with your breathing, then you can progress to HIIT training or interval training. As adaptable as our bodies are to exercise, unfortunately, we adapt just as quickly to inactivity, making it important to keep movement consistent over time. Loss of cardiovascular fitness and endurance starts to happen after as little as 12 days of no exercise. This is why we talk about establishing a program and having a plan in place for after pulmonary rehab. It's important for you to know what your next week is going to look like when you walk out of our doors. We want to make sure that you leave pulmonary rehab after investing so much time and effort into building fitness and strength for the last 8 weeks. We want to make sure that you know just what to do the following week and in the future. A final reminder that exercise doesn't change your lungs, but it can change what your body can do with the lungs that you have. That is something that you have control over. Try to create a habit. The goal isn't to be perfect and follow the guidelines perfectly. It's just to be a little stronger than you were yesterday. Establish some consistency, know your body, listen to your body, and find something that you enjoy doing. Our bodies were engineered for motion. Our bodies love to move, and there's something out there that you can find that you'll enjoy and will help you build fitness. Set measurable goals and celebrate them. It might just be that you exercised 2 times that week. If you're recovering from an illness, exercise is going to look a little bit different than it does if you're fully at the peak of a program. But don't get down on yourself. Keep moving, try to be consistent, and do what you can day to day.